Representative Young, health care was a major issue in the 2018 campaign. This year, 1 week after the election, the Supreme Court will hear a lawsuit seeking to strike down the Affordable Care Act. If the court strikes down the law, what should Congress replace it with?
Well, thank you for the question, a very important one, because health care is an issue that I hear about all across the district. I don't think the Supreme Court is going to strike the health care law down. If they find portions of it that are unconstitutional, maybe they'll take those pieces out. But I think what was really the issue was the individual mandate, which got taken care of and got repealed. Listen, we need to make sure that first and foremost, those with pre-existing conditions are protected. I've lost 2 cousins from cancer. I have an uncle with diabetes who've lost both legs, an aunt with MS, other family members with pre-existing conditions. And first and foremost, we need to make sure that those with pre-existing conditions are protected. That can be a base bill to repair the Affordable Care Act. It's not perfect, and both sides have said so. And then add on some new provisions that can bring down prices, improve the quality of care, and access as well. And I'll be at the table to do that.
Okay, thank you, Representative Young. To follow up on that, you had said that you don't believe the court will strike down the entire law. What is your position on what the court should do? Would you like to see the entire law struck down?
I don't know what the court's going to do, but I know that what Congress should do. And Congress should come together and fix the current health care problem that we have in the United States, and that's primarily dealing with cost and bring costs down. We need to make sure that we have price transparency when it comes to pricing in health care. When you do that, you can be a better shopper with your health care dollars. We need to make sure that those on the Affordable Care Act, where the subsidies have been given to insurance companies, those subsidies should go directly to the people who are on the Affordable Care Act to make sure that they're empowered with their health care dollars to better negotiate and hold providers accountable too. There's a lot that we can do. I think there's a lot of common sense, bipartisan consensus. I wish we could get to that, and I'd be at the table.
All right, Representative Axne, the Affordable Care Act has been law for the past decade, and health insurance premiums continue to rise. How do you plan to bring down the price of health insurance?
Well, this is something that I've been working on, Steve, since I started my job, and I'm happy to say that Democrats within the House have made health care a priority. The Republicans have been trying to dismantle the Affordable Care Act since its inception, and they've had years to bring to the table something that they say is better, but they've yet to do that. But all they've done is vote to take away coverage for people with pre-existing conditions. My opponent voted against Iowans. He told Iowans he would vote to protect them. In the middle of the night, he changed his vote and voted against them. He voted to take away coverage for people with pre-existing conditions. He voted to raise premiums on Iowans, especially older Iowans, by 5 times more. He voted to kick kids off their parents' plans up to age 26. And we've got to address all of these issues to make sure that we have affordable, quality health care for every single person in this country. I know the ACA isn't perfect. It's why 2 of the pieces of legislation that I wrote address this, to take away some of the costs and put it back into people's pockets, like taking away the Cadillac tax as well as a health insurance tax, so that we could help Iowans save money when it comes to health insurance.
All right, also to follow up, Representative Axne, Republicans have said rural hospitals would suffer under a public option.
She mentioned my name, Steve, and I've got the ability to respond if she mentions my name.
Okay, go ahead. I only heard my opponent, but go ahead.
Well, I am her opponent. The pre-existing condition issue, there's one person on this stage who's introduced 3 pieces of legislation to help those with pre-existing conditions. And one of them got passed, an amendment to the Republican health care bill to make sure that those with pre-existing conditions are protected. Just because you are critical of the Affordable Care Act, and you have been as well, Congresswoman, doesn't mean you oppose protecting those pre-existing conditions. It's the foray into what I want to get done on health care, to protect those with pre-existing conditions.
All right, Congressman Young, just to be clear, my opponent does not count. It has to be by name. So she will have to say Congressman Young. You would have to say Congresswoman Axne. So my follow-up question to you, Congresswoman Axne, Republicans have said rural hospitals would suffer under a public option. What specific policy proposals do you support to protect Iowa's rural hospitals?
Yeah, well, once again, this is misleading and just not true, just like my opponent who said he covers people with pre-existing conditions, but it did everything he possibly could to take away health coverage for people with pre-existing conditions, and that's a part of his history that can't be erased. A public option has been tested as far as what it would do to help people. First and foremost, it will save our country billions of dollars. Some of the best think tanks in the country that deal with medical costs and how we're going to help address this issue across this country say we'll save billions over each year, and some as high as $1 trillion over a decade. So a public option will in no way, shape, or form take away from our rural hospitals. And as a matter of fact, I have written bills to protect our rural hospitals. And recently during COVID, I made sure that we covered the reimbursement gap rate because our rural hospitals don't get reimbursed at the same rate as some of our urban hospitals do. So I have written multiple bills to make sure that we allow them to have as much access as other hospitals do.
Congressman Young, this question is for the both of you, but Congressman Young, I'd like you to answer this first. If the Supreme Court strikes down the entire Affordable Care Act, it could invalidate Iowa's Medicaid expansion, which serves more than 169,000 low-income Iowans. If that happens, what should Congress do, Congressman Young, to ensure those people can maintain their coverage?
If the Supreme Court does that, we should introduce, across party lines, a bipartisan bill to make sure that those with pre-existing conditions are protected and those who are on Medicaid have the confidence in knowing that their health care is going to be covered. That's a bipartisan issue, a lot of bipartisan issues as well. And as well, my opponent talks a lot of bills she's written and committees that she's on and caucuses she's on and letters she's written, but none of that's getting done. It's important to realize that a lot of things get introduced in Congress but doesn't get done, but I do believe, I know this, that there's a bipartisan consensus out there. We got to put politics aside, quit demagoguing these issues, because saying people don't care about one another in Iowa is not leading. That is not leading at all. That's scaring people.
All right, Congressman Young, thank you very much. Congresswoman Axne, same question. If the Affordable Care Act goes, it would invalidate Medicaid expansion for more than 169,000 low-income Iowans. What should Congress do to ensure that those people have coverage?
Well, we need to make sure that we've got a plan ready to go from the get-go if this should happen. We're fighting right now to make sure that it doesn't. The last thing that we need to see right now during COVID is people's health care taken away. One of the things that I fought for and we're continuing to fight for in the next COVID package is to make sure that folks can sign up for ACA during this process when they've lost their insurance. So we're doing everything we possibly can to make sure that we're keeping people healthy. I've always said that I'm for shoring up the ACA and introducing a public option so people can buy into Medicare or Medicaid to make sure that we can continue to cover those folks with Medicaid expansion. I will continue to support that position. I believe it's our fastest way to make sure everyone has affordable quality coverage in their own backyard. It will force us to have competitive pricing so that everybody can afford what they need, and those who want to buy into Medicare or Medicaid have that option.